You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello, welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. This is episode 97. So today, I'm continuing with this mini podcast series on kind of what goes on in the hospital, in an operating room. I wanted to talk to you about a department that you probably have never heard of. So most people, if you said, I'm going to the hospital to the ER, most people understand that's the emergency room. Most people understand that if you're going to the OR, that's the operating room. Most people understand if you go to the ICU, it's the intensive care unit. But if I said, go down to SPD, most people would say, what? So yeah, SPD. And it's called different things in different hospitals. But SPD stands for a Sterile Processing Department. So what is that? Well, when we talk about an operation, you have this idea of this glistening, clean, sterile room with all of these fancy, shiny, sterile instruments. Well, where do you think all those instruments come from? They come from a sterile processing department. And like it or not, before the instruments may have been used for your surgery, they were used on another person or hundreds or thousands of other people. And at the end of that case, all of those instruments with the blood and the guts and the gore get taken to this department. And some of these unsung heroes of the hospital are over there, full on gowned and gloved with shields, and they're cleaning off the blood and body parts of your body off of these instruments to clean them and wash them and organize them and sterilize them so they're ready for the next patient when they need those same instruments for their surgery. And there's a lot involved. So I really do think it's sort of an unsung hero procedure, because when you look at a lot of hospitals, a lot of people get in there and they've gone through school, but they don't always get paid a lot for the work that they do. Some places, especially some of the people that I worked with that were in the military, whereas if you were the scrub tech, meaning that you were in the operating room doing the cases, some days you were in sterile processing and some days you were in the operating room. And I think that was good in the ways of accountability, because even if you weren't doing the trays for your own procedure, you knew that your friend and partner may be using the instrument that you're cleaning today. So you're going to do a really, really good job of making sure that thing is sterile as possible and that there's no stuff. Because, if you don't get the bone off of an instrument, or you don't get all of the soft tissue out of that instrument, or like in our case, we use cement for some orthopedic procedures. If there's cement still stuck to an instrument, and it gets put in the tray and it gets sterilized, and now we open it up in the operating room, that tray's not sterile. You can't use that. That's what we call bioburden. So if you have bioburden, that might be human hair, human tissue, human bone, or the bone cement, that tray's gone. What happens if you get through a case and halfway through the case, someone pulls an instrument out and goes, there's stuff on this. And that can even happen in reamers. Basically, think of a drill bit that has a hole in it, what's called cannulated. So if we put a small pin and you're checking it on x-ray, to confirm the position, you might put this reamer over that pin, and then there can still be stuff stuck in that hole. So you have to clean all that stuff in SPD, and if not, that stuff has to get reported. You have to get people involved. Patient has to be made aware. You might have to go on antibiotics. It becomes a big deal, which is why this department is so important. And even our techs, when we open these trays, it's not just open them and put them on the table. It's you take the lid off and you're looking and saying, I have to go through the instruments. These are instruments that have holes in them. I have to look in there. These are instruments that we use when we cement. I have to look on those to make sure there's no cement. So there's a lot of work that goes on these multiple steps to give you those nice, clean instruments that you envision for your case. And then on top of that, once they've scrubbed it, washed it, cleaned it, sprayed it, sterilized it, those trays also, part of the sterilization process, have to get wrapped. So there's either hard trays or wraps around these hard trays, or what's new sort of new, are these cubes. So what will happen is that, like, if you have a tray, you might lay it on this sterile wrap and it gets folded and wrapped in a certain way and then sterilized like that. So in the room, we undo these wraps, and then the person that's scrubbed in can then take the tray off the wrap. But we have to check to make sure those wraps don't have holes. Again, they're not Kevlar, they're not bulletproof. So when they're moved and shifted onto trays and onto wagons and moved around, they may be put on a rack, they can develop holes in these corners. And if the hole is in the wrap, the instruments in the tray are not sterile. So that has to get taken off. We also have something, what's called a hard tray. So these hard trays, you have lids, and inside the lids goes a filter, and there's an O-ring. So a lot of parts, you put these things that you're going to use inside this component or this tray or compartment. You put the filters in, you seal the lids, which have a seal, and then you close it, and then the whole thing gets sterilized. So in a room, we can pop the handles, take the lid off so the person then can reach in and take out the sterile instruments. But then we have to check the filters. Are the O-rings intact? Did the O-rings fail? They're synthetic. And after they've been used and sterilized multiple times, the O-rings can break, so they're not sealed. The filters that we take off, do they have holes in them? If the filter has a hole in it, that whole thing is not sterile. And one of the newer things that's come out that I really like from a standpoint of climate change and trash are these cubes. SteriCube and Turbid are these two big companies. So what they have is they have this big cube, and what you can do is take your trays that you would use and your instruments that you would use and shove them all into this cube. Once they've been washed and cleaned, this is the last sterilization process. But then you put a filter on a door, shut the door, sterilize the whole thing. You bring it in the room, you take off one door, you take off the filter, and the person can reach in and pull out all of these trays. So you don't have to wrap each individual tray. And for some like total joint and spine cases, you might have half a dozen, sometimes 20 trays for like big revisions, and that becomes a lot of trash. So it's just something that I wanted you to be aware of, because a lot of people, again, have no idea what the SPD department is, the Sterile Processing Department. So just be thankful that there are people over there that are doing their job to wash all of these human body parts off of instruments and get them washed, cleaned, and sterilized so they can actually get them ready for the next case, which may be you when you need these fancy, shiny instruments. There's actually a great podcast, if you're really interested in this topic and you want to dig a little deeper. It's for educational purposes, mainly for people that work in the field, called Beyond Clean. Hank and Brett put this together. I did a lecture for them at one point just to give a surgeon's perspective on SPD and sterility and the surgeries and things that we look for. But they have a really, really in-depth platform that goes into all the details on sterile processing departments in hospitals. And you can hear all the nitty-gritty about their subspecialty niche in caring for patients by making sure that operating rooms have instruments that are safe and sterile for patients to use. So thanks again for listening. I'm Adam Rosen. I hope you've enjoyed all of these episodes. For right now, the summer's coming up. I am going to be taking a break for a while. So this is going to be my last episode for a while. I hope you've enjoyed it. If there's topics maybe that you're interested in health-wise or knee-wise that I have not covered, please, send me a note, leave it in the comments section. If you haven't already subscribed, subscribe. If you enjoy what you're hearing and you want to leave a 5-star review, that would be greatly appreciated. It helps other people like you find content like this so they can listen to it on their podcasts in their time. But again, stay safe, stay healthy. And until next time I talk to you, I'm Adam Rosen, signing off. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.